Alright, for my speech I'm going to talk a little bit about welfare and some controversy surrounding it. I'm not interested in whether or not welfare should be available or how much welfare should pay or anything like that. I believe in welfare, and I believe it is certainly in the right state of mind. My proposal is that people receiving welfare or any government benefits should be drug tested in order to receive their benefit. First of all, what is welfare? It's any government program that provides assistance to people in need. Things like pensions, unemployment, disability, survivor benefits would all be considered welfare. It's estimated that between the federal and state funding combined, welfare is over $500 billion per year, which is obviously a huge chunk of money that is all from taxpayers' taxes. To put it into perspective, welfare programs are $6,000 for every household paying taxes, which is that's a lot of money, and I think those people, the majority of them probably wouldn't mind paying it so much as long as they know it's going to the right people. A few poverty statistics is from 2008. 19% of people under the age of 18 were considered in poverty in the U.S. From 18 to 64, 11.7%. Then people age 65 and older, it goes down again to 9.7. But those numbers, you add them up, you get 39.8 million people living in poverty across the country, which is a poverty rate of 13.2%. It's really high. So welfare programs, do they work? Question of whether social welfare programs actually benefit the poor is not a simple answer at all. It's very complex. Often depends on the type of program, how well it's run, and how do you measure the success. A couple of examples: Social Security is considered a mainstay among America's senior citizens as well as the disabled. There's no doubt that millions of senior citizens who have received benefits over the last 75 years would have been far worse off without. Some may have been even homeless without. Medicare, there's deep divisions about Medicare, both houses of Congress. But even with the division, there's rising medical costs, healthcare costs, and even with the Medicare benefits, senior citizens still have to choose whether they're going to buy groceries or prescriptions oftentimes. Even 10, 15 years ago, Medicare covered probably everybody's bills. The rising cost has gone up, and the Medicare benefit has almost stayed the same. And then what most people would consider welfare, it's called a Temporary Assistance to Needy Families, TANF. It was created in 1996 to aid families with dependent children. It's the most controversial one, in spite of its answers continuously to respond to critics. People on welfare, what do they receive? It varies from state to state. Every program can be different, but it's a combination of food stamps, cash, housing benefits, assisted housing, schooling for the kids, and transportation to and from school. How much does it cost? We've covered this a little. I have a pie chart here. This is from 2000, so you can see it was only 434 billion per year in 2000. It's already over 500 10 years later. But the blue is the federal tax. The yellow is the state tax. Federal is over 71%. So my proposal is that anybody receiving welfare benefits should be drug tested, and of course have to pass their drug testing. A few reasons I stand by that is most employees who are working for their income are drug tested. If they fail the drug test, oftentimes they at least are on suspension. They may lose their job outright. Excuse me. And why would people like to pay for others to use drugs when they're supposed to be paying for others to have food and housing? Currently, there's many states proposing similar laws. For example, in West Virginia, Craig Blair, he's proposed legislation for random drug testing for anyone that receives food stamps, unemployment benefits, or welfare programs. A quote from him is, "Nobody's being forced into these assistance programs," which I currently agree with. Nobody's even asking you to not do drugs. Simply don't do drugs and still accept other people's tax money as your benefit. Since then, several other states have similar laws, such as Kansas, Oklahoma, Missouri, Hawaii, half a dozen more listed there. How much would drug testing cost? A very simple answer, the drug test costs about 25 bucks. Some people charge more, but many employers do drug testing. It's 25 bucks a person, and it's over with. You can make it random drug testing. You could be every time you get a benefit. You have to pass your drug test. Most proposals take the 25 bucks right out of the people receiving the benefit. So if they're getting 200 bucks, they get 175 now. You could do it that way. You could split it with the state, maybe at $12.50 a piece, have the state cover it. I don't really care who pays for it. Another example is a Georgia lawmaker named Michael Hardin. He sponsors a bill for random drug testing, anybody receiving benefits. He has a quote from taxpayers, or about taxpayers, saying they want to know without a doubt their tax dollars are not going to support illegal drug activity. If so, the state would cut off anyone who refuses the test or fails the test. And I think he brings up a good point that people may not consider, as well as keeping them off drugs. It's to make sure the unemployment line, people on the unemployment line have the ability to get back to work. What he means by that is most people, when they hire an employee, they give a drug test initially before he can even be employed. And a lot of these people are on drugs, so they fail this drug test and they can't get a job. They refuse to get off drugs because they're receiving welfare benefits. They try to get a job, they can't do it. So at least trying to clean up a part of the population on the drugs would help them to find a job. Of course, by not paying people who fail the drug test, you could save hundreds of millions, maybe billions. It's tough to estimate that number, but it's a lot. And I'm not even suggesting the hundreds of billions saved should go right back into the taxpayers' pockets. I think you use it to help the people that have the problem, get them treatment, put them in a clinic, anything to guide them off of drugs and help with their addiction. People against drug testing for welfare beneficiaries, their biggest argument is their kids. The kids are reaping the benefits of the money, the food stamps, of course, they're eating, they're getting housing. If you take that away from them, you're not affecting the drug user, you're affecting the kids. And I agree with that. I don't know of anybody that would argue they want the kids to be on the streets. A couple of ideas. In my opinion, if the parents are on welfare, they're addicted to drugs, they're probably not very good parents anyway. That doesn't go for everybody, but I would suggest most of them aren't. So you can maybe give them an ultimatum. They fail the drug test, they're trying to collect unemployment. I'll tell them, sure, we'll give you, or I should say welfare, we'll give you your welfare check, but you have to join a treatment center, or you have to join a parenting center, or you have to prove that you're being a good parent. If you're not willing to do this, maybe you have to look further. Maybe they shouldn't even be a parent. Maybe their kid should be not necessarily an orphanage is better, but adopted or with somebody that can take care of them. I'm not just suggesting drug testing for people on welfare who are in poverty or trying to get at the poor. I think anybody, people who are collecting unemployment benefits, they should have to pass a drug test. People are receiving government loans, a lot of school loans are federally funded. I think to do that you should have to be on a drug test. Many college kids have spent tons of government supplied money probably on drugs while they're in college. Tax credits, there's big housing credits. Anybody that gets a government supplemented income, I think before they receive their money should have to prove that they're not on drugs. So finishing up, the point of it isn't to try to leave people on the street. The point of it is to try to get drugs out of families. People with small kids are on drugs. Let's try to clean them up and actually help the kids. Reduce the drug problem in the U.S. And of course, to make sure all government-funded money is spent on its intentions. Is there any questions? All right. If you want to just give a feedback in the camera.
I thought it was a very good speech. It's a very good topic, very controversial, but it has a lot of good points. I think you did a great job explaining all the several different points.